My name is Jocelyn Palacios, and I'm going to talk to you all about strokes. I'm going to begin with background information. What is a stroke? A stroke is when a blood vessel in the brain becomes ruptured or obstructed, resulting in the death of brain cells. Symptoms can last more than 24 hours, therefore, medical attention should be given as soon as possible to reduce further brain damage. There is two types of strokes, ischemic and hemorrhagic. Ischemic strokes account for 87% of cases. This is the most common type of stroke. It occurs because of arteriosclerosis, a condition in which calcium, cellular waste, cholesterol, and other substances builds up in the inner lining of the arteries, known as plaque. Plaque progresses and gets bigger, as well as it hardens, resulting in the obstruction of blood flow to the brain. There is two main types of ischemic strokes, thrombotic and embolic. With thrombotic strokes, a blood clot known as a thrombus forms in an artery in the brain. This prevents blood from flowing to that part of the brain. With embolic strokes, on the other hand, plaque debris or a blood clot detaches from the inner lining of the arteries, known as an embolus. An embolus travels through the bloodstream up until it reaches a small artery in the brain, where it blocks blood from flowing, known as an embolism. Now there's hemorrhagic stroke. A hemorrhagic stroke is when rupture or bleeding of a blood vessel occurs caused by a brain aneurysm bursting. Hemorrhagic strokes account for 13% of cases. With hemorrhagic strokes, blood flow to the brain is prevented. Then cells aren't able to receive nutrients and oxygen. Because they aren't able to receive nutrients and oxygen, brain cells die. Pressure begins to develop around surrounding tissue, which causes irritation and swelling, resulting in further brain damage. Hemorrhagic strokes are divided into two main categories as well, into cerebral hemorrhage and subarachnoid hemorrhage. With intracerebral hemorrhages is typically caused by high blood pressure. With high blood pressure, it causes a rupture. The rupture causes vast amounts of blood flow into the outer part of the brain. The blood is released from an artery from the blood is released from the artery, which forms a clot in the brain tissue known as a hematoma. As the blood cells within the hematoma continue to die, toxins are released, causing further brain damage. Then there's a subarachnoid hemorrhage, which is where bleeding occurs between the brain and the membrane that covers the brain. With a subarachnoid hemorrhage is typically due to an aneurysm or trauma. Symptoms. According to the Mayo Clinic, people experience symptoms such as trouble speaking/understanding, paralysis or numbness of the face or legs, trouble with seeing in one or both eyes, headaches, and trouble walking. Here are images of these symptoms right here on the right side. If a loved one or a friend is suffering from a stroke, the best way to know if it is a stroke is the FAST test. The first symptom is face drooping. Does one side of their face droop? Another symptom is arm weakness. Does one side of their arm droop downwards? Are they able to lift both arms? Do they have speech difficulty? Is their speech slurred? Does their speech sound strange? If they experience any of the above symptoms, it's time to call 911 immediately, because those are symptoms presented that are warning signs someone is having a stroke. There are people who are at a higher risk of suffering a stroke. Certain factors can put you at a higher stroke, such as diabetes, because diabetics lack a hormone insulin, which puts them at a higher risk of suffering stroke. High blood pressure. High blood pressure has been known to be the biggest risk factor that leads to stroke. Age. The older you get, the higher risk you are of suffering a stroke. Gender. Though men at a young age are more likely to suffer a stroke, women, on the other hand, are at a higher risk of dying from one. Treatment options. Now, the treatment options depends on what type of stroke. With ischemic strokes, there's APACE IV RTPA, which is a tissue plasminogen activator. This can be given through an IV. What happens is that it dissolves the clot so that blood can be able to flow again. This has to be given 3 to 4.5 hours after the stroke. Then there's mechanical treatment, which is where physical removal of the blood clot with a mechanical thrombectomy is used. Now, the stent removes the blood clot, and special suction tubes can also be used to remove the blood clot. This should be done within 6 hours of someone experiencing stroke symptoms. With hemorrhagic strokes, on the other hand, there's also mechanical treatment. What is used in a hemorrhagic stroke is a catheter, which is a small tube that is threaded up any major artery within the arm or the leg. The catheter is guided to the brain so that the surgeon is able to see and therefore fix the problem. Once the catheter reaches the area of the brain, it is guided all the way to where the bleeding occurs. Then mechanical agents such as coil is deposited to stop bleeding. In some cases, though, surgery is needed to make sure bleeding doesn't reoccur again. So, lastly, I'm going to give you guys current news and information about strokes. Anti-diabetic drugs and strokes. There has been studies found that anti-diabetic drugs have been linked to a higher risk of cardiovascular diseases and strokes. According to a safety review conducted by the Food and Drug Administration, medicines with saxagliptin and allogliptin had been found to increase your risk of heart failure, whereas a different study done by the European Journal of Internal Medicine, sulfonylurea had been proven to be non-harmful in some studies and harmful in others. The European Journal of Internal Medicine also stated that metformin has been considered to be the best choice for obstructing cardiovascular diseases and strokes. Technological advancements in strokes. There has been new technological advancements for people after a stroke, which they tend to become incapacitated. So what they're trying to do is find new ways technologically to make the rehabilitation process quicker and faster. There has been a functional electrical stimulation, which is a system that uses electrical impulses to stimulate non-functioning muscles. There was 2 studies done to determine if it was better than conventional therapy. The first study has been found not effective for improving patients' muscle movement, whereas the second study found that functional electrical stimulation has been better than at-home rehab or no rehab at all. Then there has been neurorehabilitation in strokes, an invention done by Fraunhofer Institute of Berlin, known as the haptic walker. It was beneficial because patients were in charge of their body's movement, and it helped patients as well be able to progress faster and easier in a better way. And that concludes the end of my PowerPoint.